I've been a teacher, a principal, and now I'm a doctor, and I've got to say, I've never seen anything quite like this. ABA therapy, or applied behavior analysis, is supposed to help individuals with autism, but there's a lot more going on behind the scenes that we need to discuss. Okay, so money. That's where things get really interesting with ABA therapy. We're not talking about a couple $100 a month here. No. We're talking tens of thousands of dollars every single month. It's like, imagine if your car payment was suddenly the size of a house payment, and then multiply that by, 5 or 6. That's the kind of financial burden we're dealing with here. And I don't know about you, but when I hear about something that costs that much, I expect it to be like really high quality stuff, you know? But, what I've discovered about ABA therapy has left me, well, let's just say, more than a little concerned. So, here's where things get really wild. You'd think that for tens of thousands of dollars a month, you'd be getting treatment from, doctors with multiple PhDs or something, right? But nope. A lot of the people actually implementing ABA therapy are what's called RBTs, or Registered Behavior Technicians. And get this, to become an RBT, you don't even need a college degree. You just need a high school diploma and a certificate. Now, don't get me wrong, I'm not saying these RBTs are bad people or anything. But it's like, imagine if you went to a hospital for surgery, and instead of a surgeon, you got someone who watched a few YouTube videos on how to operate. It's mind-boggling, really. Now, let me put on my doctor hat for a second. Specifically, my radiation oncologist hat. In my field, if I'm treating a patient, I'm the one doing the work. I'm mapping out the treatment. I'm talking to the patients. I'm right there in the thick of it. And that's how it is in most medical fields. But with ABA therapy, it's like this weird pyramid scheme. You've got the people at the top with all the qualifications, and then this huge base of RBTs doing the actual work. And look, I get it. Delegation is important in any field. But when you're charging astronomical amounts of money for a therapy that's supposed to be life-changing, shouldn't the most qualified people be the ones actually implementing it? So, yeah, that's the deal with ABA therapy. It costs a fortune. It's often not implemented by the most qualified professionals, and its structure raises some serious questions. As someone who's been on multiple sides of the education and medical fields, I can't help but feel that something needs to change. Because at the end of the day, this isn't just about money or qualifications. It's about providing the best possible care for individuals who really need it. And right now, I'm not sure that's what's happening. We need to have a serious conversation about how we can improve this system to better serve those who depend on it.